Hi, I'm Rebecca Wiles and I'm going to be doing my capstone project. My presentation is over medical tourism, so I'm going to go ahead and start. So my title is medical tourism. So first of all, what is medical tourism? Well, it's when patients or people travel to other countries for medical attention. This could be for breast augmentation, liposuction, hip replacement, in vitro treatment, stem cells. These are just examples, but it could be from the basic going to the dentist to open heart surgery. But the idea is that patients are traveling across the country to different countries in order to receive medical treatment. My next slide is why. So why are people traveling for medical treatment? The big reason is because it is cheaper. In one of my articles, a couple, Steve and Sarah Rizzo, wrote that a 60,000 knee replacement in the US would cost 11,000 in Costa Rica and 9,000 in Taiwan. So for a patient who doesn't have extra money lying around to get the knee replacement they need, or to get cancer treatment that they need, they will travel to different countries in order to get the treatment at a price they can afford. The next thing is why people are traveling is because it's more available. When you open up the world to the medical field, that just increases that many more people and resources that are available for patients to see. The next thing is quicker treatment. Here in the United States, you could be on a waiting list for a lung that you need because you need a lung transplant, or you are on a wait list to receive a new trial drug. If you go to other countries, they might not have this waiting list, or it won't be as long. So you would be able to get your same treatment quicker, and it could possibly save your life. Another reason is it could be illegal in your home country. An example of that is patients who have stem cell treatments, where some treatments or research is not approved by the FDA in the US, so they will travel across to Mexico or to to Europe or something in order to get the stem cell research and treatment that they need. Okay, next. So what are the problems? Well, the end problem, the big problem, could be possible death. But some other problems that are associated with medical tourism are infections. These facilities are possibly not under the same expectations that the hospitals and facilities in the US are, so they might not be as sterile during their procedures. They might not give prophylactic antibiotics to make sure that you're not getting an infection after the surgery. So there's always a risk for infection because they might not be following the guidelines. Another problem is the lack of follow-up care. So if you travel down to Mexico to get liposuction, and you would need to go back in order to have a follow-up consult with the physician or the surgeon, and to make sure that your incision's doing well and that everything else is doing okay. If you go to a different country, that would be another trip that you would have to take. So patients sometimes just don't go to a follow-up consult, and that could also lead into an infection. Another thing would be complications. There was an article I read about a woman who had gastric surgery, bariatric gastric surgery, and they were going to put a sleeve over her stomach. Well, the sleeve wasn't secured right, and it slid down and caused her an extreme complication that almost caused death. So when these physicians might not be licensed or might not have the right credentials in order to do these surgeries, there are the risks of complications. The last thing is a scam. So there's always a risk of not going through legit physicians and resulting in you losing money in the end. So the big thing is, if you are deciding to travel for healthcare, how do you stay safe? So there are actually companies that do research on physicians and hospitals to ensure the patient's safety. So these people do research on physicians and hospitals to make sure that their credentials are up to date, that they're accredited by whatever the accreditation facility is in their country. In the United States, we use the Joint Commission, and so I listed that website here for you. And then another website it's called Patients Beyond Borders. It's a website that you can go to, and it's very user-friendly. You just type in the surgery you want, type in the area that you want to go, and then it'll bring up facilities that are going to be safe and quality care for the patients to use. So in the end, the big thing about traveling for healthcare is making sure you're doing your research. It can be done safely, but going through the right resources and making sure that you're checking the hospitals and the physicians that are going to be where you're attending is going to ensure that you are getting the safest and most quality care that they can provide. As long as you follow those steps and you make sure that they're accredited, you most likely will have a successful surgery or procedure. Thank you for watching.